Most men don't feel the beginning of prostate cancer. They feel tired. They wake up twice a night to pee. They dismiss a slow stream, a dull ache, a little stiffness. It doesn't scream, it whispers, and when it finally becomes obvious, it's often already deep. What if what you've brushed off was never just age? Today I want to show you the signs that don't knock loud, the ones you've likely already felt, but never named. His name was Paul, 73, retired engineer, lived alone, quiet man. Came in only because his daughter insisted. He said, "It's probably nothing, doc. Just getting older, right? Frequent nighttime urination, some hip discomfort, a weaker stream, and a small trace of blood. Just once." He almost didn't mention it, but his scan said otherwise. Stage 2. Quiet, growing, hidden behind the everyday. Paul's story isn't rare. It's how prostate issues introduce themselves, gently, subtly, disguised as normal. That's why today's conversation matters. This isn't about panic, it's about pattern. You don't need a medical degree to notice early signs. You just need to know what not to ignore. 1. When urine feels like fire. It usually begins quietly, a little sting, a strange warmth, and then it passes. So you drink more water, you wait, you ignore. But when urination starts to feel like fire, it's no longer just a passing irritation. It's a whisper from deeper inside. The prostate sits just beneath the bladder, wrapped around the urethra, like a soft ring around a pipe. When inflamed, it presses in, and what once flowed freely now burns. You may think it's just a urinary tract infection, and yes, UTIs do happen, but here's what most men don't know. Recurring UTIs in men over 50 are rare, unless the prostate is involved. A 2020 study from the Journal of Urology found that over 65% of male recurrent UTIs in their 50s and 60s were linked to underlying prostate inflammation or enlargement. The signs? Burning during urination, cloudy or foul-smelling urine. A constant urge, but a weak stream. Lower abdominal discomfort that feels like tight pressure. These symptoms come and go, which is why they're so often dismissed. But think of them like a rusted pipe under pressure. It might still carry water, but eventually it leaks, it cracks, and the damage is far more than what shows on the surface. Here's something simple you can do right now. Track your next 3 urinations. Note the following. Was there burning? Did you feel fully emptied? Was the stream strong or weak? Did you need to push? You don't need a diagnosis yet. You just need a pattern, because when the same discomfort visits more than twice, it's time to listen, not guess. Sometimes the body doesn't scream because it's been trying to protect you gently until you're ready to hear. So, let me ask you quietly. When was the last time you really noticed how your body eliminates waste? Not just if you went, but how it felt. 2. The stream that hesitates. It doesn't feel dramatic, just slower, more waiting, a little pressure in the belly, a stream that used to come easily, now trickles, hesitates, starts, and stops. Most men call it aging, but your bladder and prostate might be trying to say something different. Let's get specific. The prostate surrounds the urethra, the thin tube where urine exits. As the prostate enlarges, even slightly, it compresses that tube. Not a blockage, a squeeze. Think of it like a garden hose bent gently by a hand. Water still flows, but not the same. A study from the National Institute on Aging found that over 50% of men aged 55 plus experience reduced urine flow due to early-stage benign prostatic hyperplasia, BPH, a non-cancerous growth that often starts years before symptoms become severe. The early sign? Intermittent, weak, or delayed urine stream, especially in the morning when hormones shift and hydration is low. You may also notice longer time to empty your bladder, needing to push or strain slightly, a stop-and-go rhythm while urinating, dribbling at the end. These aren't random, they're biological patterns, and your body is tracking them even if you haven't yet. So here's a quiet home practice. Time yourself. Next time you urinate, take out your phone timer. Start at the moment you begin. Stop when you feel finished. Do this morning and night for 3 days. Write it down. Compare. Is it consistent? Slower in the morning, taking longer over time. This isn't about perfection, it's about awareness. And if your stream has changed, if it no longer feels free or complete, your body may already be adapting to something growing beneath the surface. One of my patients said it best, "I didn't know my body had learned to compensate until it couldn't anymore." Have you noticed yourself standing longer over the toilet, waiting for a stream that used to arrive like a reflex? The prostate doesn't demand your attention loudly. It simply adjusts pressure and lets the rest unfold, quietly, slowly, until you begin to listen. 3. Nights that don't let you sleep. At first, it's just once a night, then twice. Soon, sleep breaks into fragments. You wake, half aware, feet on cool tile. The bathroom becomes a midnight ritual. Most men blame hydration, or stress, or age. But when your body calls you out of sleep night after night, it's not just thirst, it's your bladder-prostate circuit misfiring. See, your bladder and prostate have a built-in rhythm. At night, the body is meant to reduce urine production and signal deep rest. But when the prostate is inflamed or enlarged, it stimulates the bladder. Even if there's only a small amount of urine, think of it like a motion detector that's lost calibration. Even the slightest shift triggers an alarm. This condition is called nocturia, and it's one of the earliest biologically significant signs of prostate trouble. According to a 2022 Cleveland Clinic report, men over 60 who urinate more than once per night are twice as likely to have underlying prostate involvement than those who sleep through. But again, it feels so normal, so excusable. You're tired, you had tea late, you're just aging. Number: if you were sleeping soundly before, and now your nights feel broken by urgency, your nervous system and bladder chemistry may already be reacting to changes you cannot see. This isn't just about sleep, it's about recovery, hormone regulation, cellular repair, memory consolidation. When sleep is lost to the bathroom, the body begins to age faster from within. So, what can you do? Track for 5 nights. What time did you go to sleep? How many times did you wake to urinate? Were you able to return to sleep quickly? Did you feel rested in the morning? And try this. Limit all liquids after 7:30 p.m. Avoid caffeine past 2 p.m. Place a notebook by your bed. Note every wake-up. This is not a test, it's a pattern. And patterns don't lie. One man told me, "I didn't realize I was living in fragments until I finally slept through." So, let me ask you, when was the last time you woke up and felt whole? 4. The red you weren't expecting. You look down, and there it is, a pink hue in the toilet bowl, a rust tint in your semen, and for a moment, everything stills. Then your mind moves quickly. Maybe it's from something I ate. It's probably just a burst vessel. It only happened once, so you forget. You move on, but the body doesn't send red unless something has been brewing. It's not a punishment, it's a signal. Blood in urine or semen is like a whisper written in scarlet, the kind of whisper that asks you to stop and listen deeply. Medically, this is called hematuria, blood in urine, and hematospermia, blood in semen. These symptoms, while sometimes caused by infection or kidney stones, can also indicate prostate inflammation, abnormal growth, or early-stage cancer. Here's what matters. Even a single occurrence needs to be taken seriously. A review in the British Journal of Urology International, 2021, found that among men aged 50+, the presence of microscopic or visible blood in urine was associated with a 28% increased risk of prostate abnormalities, especially when combined with urinary symptoms or pelvic discomfort. But because there's no pain, because it often doesn't return the next day, many men never speak of it again. Please don't wait. Blood in the body's waste systems is like finding a red thread sewn into a white cloth. It doesn't belong. And even if it's just one strand, it changes everything. What to do if you notice it? Don't panic, but don't delay. Schedule a urinalysis and PSA blood test. Write down when it happened, what followed, and if any discomfort was present. Even if it never returns, that single moment may give your doctor the clue needed to look deeper, before it becomes harder to treat. And if you've ever seen it, even once, ask yourself honestly, why didn't I tell someone? There is no shame in early detection. There is only power, and the sooner you bring this quiet red into the light, the more life waits on the other side. 5. Pain where you didn't look. It doesn't feel like prostate pain, because it's not where you expect it. It might show up in your hips or deep in your lower back. Sometimes it hums in the pelvic floor like a quiet tension you can't quite stretch away. You try to explain it. I must have slept wrong. It's probably my old mattress. I sat too long yesterday. But the pain returns, software dull, unfinished. The truth is, the prostate rarely hurts in isolation. Instead, it sends signals to surrounding nerves, and those nerves echo the message elsewhere. This is called referred pain, and it's common when prostate inflammation, infection, or early structural changes begin to affect the body. Imagine the pelvis as a locked drawer. When inflammation builds, it doesn't leap out. It pushes quietly against everything around it, the muscles, the nerves, the ligaments, and your body answers with ache. A study in the Journal of Men's Health, 2020, showed that up to 40% of early-stage prostate disorders in men under 65 presented first with nonspecific pelvic or lower back discomfort, often misdiagnosed as muscular strain. Here's what to look for. Aching that doesn't improve with rest. Tightness deep inside the hips or groin. Pain that intensifies after sitting long or bending forward. A feeling of weight or pressure in the pelvic cradle. Most importantly, it's not tied to injury. It lingers like a hum you can't turn off. Here's a quiet practice to begin. For 7 days, keep a body map journal. Each evening, mark where you felt tension or ache, what you were doing before it began. What, if anything, brought relief, heat, walking, etc. This small act of observation turns vague pain into clear data your doctor can actually use. One patient told me, "I thought I was just getting older, until I noticed the pain only came after I held my bladder too long. So now I ask you, is there a part of your body that's been speaking, but you haven't yet asked it what it wants to say? Because sometimes the place that hurts isn't the place that needs help. And listening is where healing begins." 6. When intimacy shifts in silence. He didn't want to talk about it at first. Most men don't. Erectile changes feel private, too wrapped in identity, too easily blamed on stress, on age, on anything else. But when intimacy begins to change, quietly, steadily, it often holds more meaning than we allow ourselves to explore. It might begin as a softer erection, or one that fades too soon. It may take longer to feel aroused, or the response simply feels different. No drama, no alarms, just a quiet shift in something that used to feel reliable. Here's what many men don't realize. The same vascular and nervous systems that govern sexual function are deeply intertwined with prostate health. The prostate sits near critical blood vessels and nerves involved in erection. So, when inflammation begins, when the structure changes, even slightly, it can send subtle ripples through the system. Imagine your body's sexual energy like a candle in a still room. It doesn't need wind to go dim. Just a slow depletion of fuel, just a quiet weight on the wick. A 2018 study in the International Journal of Impotence Research found that men experiencing new onset erectile dysfunction, especially those over 50, had a 1.6 times higher likelihood of underlying prostate inflammation or compression, even when PSA levels were normal. What makes this harder to notice? It doesn't always come with urinary symptoms. Sometimes this is the first sign. The body often withholds pleasure when it's trying to protect itself. What to do if you notice changes? Ask, when did this begin? Is it sudden or gradual? Have you also noticed urinary shifts, pelvic pressure, or fatigue? This isn't about shame. It's about signal. It's the body asking for care, in the only language it knows how to speak. You're not broken. You're being alerted. And here's something most men never hear. ED can be a gift because it's early. It shows up before deeper damage settles in. One man told me, "I thought I was losing my manhood. Turns out I was gaining a second chance." So I ask you gently, when was the last time you gave your body permission to tell the truth, even if that truth made you uncomfortable? There is no weakness in noticing change, only strength in listening sooner than most. 7. The ache that doesn't obey rest. This pain doesn't go away with rest. It doesn't yield to stretching. It doesn't shift with a new chair or a softer mattress. It settles in the pelvic bowl, low, internal, persistent. It hums through the day like a distant engine, quiet, but always there. By the time many men notice this kind of discomfort, it has already been present for months, masked, dismissed, attributed to everything but the prostate, because we are taught to wait until pain becomes obvious, until it screams. But the deep pelvic ache associated with prostate changes doesn't scream. It waits until you listen. This kind of ache is typically caused by inflammation pressing against internal pelvic muscles, tension along the pudendal or sacral nerve pathways, structural irritation due to early prostate growth or congestion, and yet many men confuse it with muscle strain or even digestive discomfort. One of my patients described it best. It was like something was clenched inside me, but I couldn't find where. I often tell men, the pelvis is the basement of the body, and the prostate is its furnace. When it overheats, everything around it tightens, not just physically, but emotionally too. A 2021 analysis in Urology Times found that chronic pelvic pain syndrome was one of the most underdiagnosed conditions linked to early-stage prostate inflammation, often mistaken for sciatica or irritable bowel symptoms. So, what can you do? Begin with a 3-minute morning body scan. Sit still before standing. Breathe deep into your lower abdomen. Ask, is there tightness, soreness, or pulling anywhere deep inside? Note if it radiates backward toward the sacrum or forward toward the groin. If the ache increases after holding urine, worsens after intimacy lingers despite rest, then it's time to consider that the source may lie deeper than you've looked. You don't need a diagnosis to begin awareness. You just need the courage to name what you feel. So, now I ask, as a doctor and a man, what ache have you been carrying? Because no one ever told you it mattered. You don't have to wait for the pain to shout. You can whisper back, I hear you now. 8. What you can start doing now. Awareness is the beginning, but change asks for a second step. And often that step is quieter than you think. The prostate doesn't ask for war. It asks for peace, for flow, for less friction in the systems around it. So, let's talk about what helps, not in crisis, but in everyday care. 1. Feed the fire less, nourish the roots more. Certain foods calm inflammation, not by attacking, but by restoring balance at the cellular level. Cooked tomatoes, rich in lycopene. A study in Cancer Epidemiology, Biomarkers and Prevention, 2014, found that men who consumed cooked tomatoes greater than or equal to 5 times per week had a 28% lower risk of prostate cancer. Green tea, EGCG compound, EGCG, slows abnormal prostate cell growth. One 2020 Journal of Urology trial showed reduced PSA levels in men drinking 2 to 3 cups per day. Pumpkin seeds, zinc plus phytosterols. Zinc helps regulate testosterone and reduce inflammation. Add 1 to 2 tablespoons daily. These aren't exotic, they're simple. And your kitchen is your first clinic. 2. Support doesn't always come from pharmaceuticals. Several natural compounds have shown promise in supporting prostate health. Saw palmetto extract, shown to reduce BPH-related urinary symptoms. Pygeum, African plum bark, may ease nocturia and pelvic pressure. Stinging nettle root, anti-inflammatory, supports urinary flow. Consult your doctor if you're taking medications. But know that many of these have centuries of safe use. 3. Gentle movement equals inner massage. Try this ritual. Pelvic tilt plus breath work, minus 3 minutes every morning. Lie on your back, knees bent, feet flat. Inhale deeply through your nose. As you exhale, gently tilt your pelvis upward, flattening your back into the floor. Repeat for 10 breaths. This helps relax the pelvic floor, improve blood flow, and release stored tension. Think of it as an oil change for your inner engine. Begin the ritual of noticing Pliwing nourishing. Each morning for 7 days, drink 200 milliliters warm water. Plus, 1 teaspoon olive oil supports bile flow, plus inflammation. Add one anti-inflammatory food to breakfast. Write one sentence. Today, I support my body by not drastic, but real. And real becomes rhythm. So, let me ask you now, what's one thing, just one, you can add to your day that feels like a gift to your future body? Because healing isn't just about stopping pain. It's about creating conditions for peace to return. And your prostate, like every part of you, was built for flow, not fight. You've listened, you've remembered, and now you've been given something to begin. A food, a breath, a practice. Small? Yes. But when done with intention, a single change can redirect the current of the body. You don't need to overhaul your life overnight. You just need to say, I'm willing to care for this part of me before it breaks. Because the prostate isn't just tissue. It's memory, it's flow, it's stability in the unseen parts of a man's world. And care isn't something you earn only when something goes wrong. It's something you're worthy of, right now. So take this in. All those signs, they weren't warnings. They were invitations to nourish, to rest, to return, not out of fear, but because you finally remembered this body isn't a burden. It's your oldest companion. Start one thing this week. Add cooked tomatoes to lunch. Do 3 minutes of pelvic breath each morning. Replace evening tea with warm herbal water. Have you ever tried a natural remedy for your prostate? Share it below. You might light the way for someone else. We aren't just healing ourselves, we're changing the way our sons will speak about their bodies. And that is a legacy that flows deeper than blood.